Our group project is on the prevalence of chlamydia among college students in the United States from years 2010 to 2018. The members in this group are Giselle David, myself, Avery Hidalgo, Irene Tree, and Daniel Yu. Chlamydia is spread through Chlamydia trachomatis, which is the most causative agent of bacterial sexually transmitted disease. Basically, it enters into a non-phagocytic cell and it invades the nucleus to start replicating itself to cause for the outbreaks and increased spread of chlamydia. Chlamydia is transferred much like other STIs from a partner who's infected to someone who isn't, passed primarily during anal or vaginal sex. It can also be transmitted from a mom to a baby during birth. It's basically passed when the mucous membrane or the soft skin covering all the openings of the body, such as around your anal area or vaginal, it comes into contact with the mucous membrane or secretions of semen of an infected person. You don't even have to have the penis or the tongue that's infected go all the way into the vagina or anus. It just needs to come into contact with the infected area or the fluids from this infected area for someone to become infected. It is less likely to be transmitted during oral sex just because this disease prefers to contact the genital area rather than the throat. While it's less likely, you can still contract chlamydia through oral sex. You can also get chlamydia in your anal area for a woman even if you've never done anal or anything like this, due to the spread from the vaginal area if you are infected, such as like wiping with toilet paper. So that's something to be cautious of when you have an outbreak. Eye infections also result when the discharge carries to your eyes. So if you touch an infected area without knowing and then rub your eyes, this is a common way that it's spread from a mother to a baby. Is if someone's infected in their vaginal area, this fluid hits the baby's eyes, and that's where they become infected. A misconception that a lot of people have is that you can get chlamydia through shaking hands or toilet seats, but that is not true. You have to come in contact with the bodily fluids or that open area. The problem with chlamydia is very high, especially those within college. This is the most frequently reported bacterial sexually transmitted infection in the United States. According to CDC, from reports from 50 states and the District of Columbia, 1,598,354 cases were reported, but they estimate roughly 2.86 million infections actually occur, but people don't report them because symptoms are asymptomatic, and so a lot of times they don't actually know that they've become infected with this disease. It might be hard to see, but what this graph is showing is males versus females who become infected at a rate per 100,000 population. If you look closely, the most prevalent is going to be in women from ages 20 to 24, and this is important due to the fact that our focus is on college students, and this age is a very prominent age within college, and they're the ones who are exposed to it and infected the most. Chlamydia does not kill people, but it does cause serious damage, especially for women, since we are the most affected. It can cause for a spread of the disease into the uterus or fallopian tubes, which causes for multiple issues such as pelvic inflammatory disease, subclinical inflammation of the upper genital tract, and it can cause permanent damage to your fallopian tubes, your uterus, which then leads to chronic pelvic pain, infertility, and ectopic pregnancies, which is where your egg implants in the wrong area and you have to get it removed. In terms of economic costs, an individual spends roughly $179 every time someone contracts chlamydia, $99 for the doctor's visit, $44 for the diagnostic test, and $36 for the treatment. This means that with our data, it ranges between $258.3 to $775 million annually for the government as well as the person individually. This is really important because once you're exposed to chlamydia, it's not something that is fully cured. It will become dormant in your body, which is why you're more susceptible to have it happen often, which means every single time you contract chlamydia, you're going to have to pay roughly $200. And say you contract it 6 times, that's already $1,200 down the drain, when something as simple as condom usage would prevent this. So we need to address this problem to prevent an epidemic or a breakout, especially within college students where people are more susceptible to it.
Hello, my name is Irene Try, and I will be moving on with 3 more topics that has to do with the prevalence of chlamydia among college students in the United States from 2010 to 2018. The clinical symptoms that are presented upon a chlamydia infection in women are vaginal discharge that has a foul odor, sharp pain and burning sensation when urinating, intermittent bleeding, and painful sexual intercourse. When men contract chlamydia, their clinical symptoms are discharge coming from the opening of the penis, painful urination, and tenderness in the testicles. The modes of transmission make it possible for chlamydia to spread to new hosts, or organisms, which in this case are human beings, where the agent inhabits to multiply in order to spread the infectious disease. The modes of transmission, or the methods that help to spread the disease, include vaginal, anal, and oral unprotected sex with a partner who is infected with chlamydia. If the necessary precautions are taken, the cycle of spreading chlamydia can be broken to prevent the development of new cases. There are several mechanisms that are used to control the problem or spread of chlamydia. One mechanism is the use of latex condoms, which is a physical contraceptive and creates a barrier that prevents the sexually transmitted infection from spreading to other sexual partners. This is categorized under the primary level of prevention because necessary prevention measures are taken to eliminate the possibility of disease and there is no sign of the disease. Another mechanism is to have routine physical examination health screenings that are recommended every year. This is part of secondary level of prevention because health screenings help to detect any sign of infection before it produces any future health complications. This level of prevention helps those, such as college students, that are asymptomatic to detect the presence of chlamydia. The use of contraceptive devices and scheduling annual health screenings help to reduce the risk of contracting chlamydia. Since it is caused by a bacterium, antibiotics can be used to kill off the infection. However, since this is considered tertiary prevention, complications from the prolonged exposure may have already surfaced. The more severe health issues that may arise from not taking the necessary precautions are infertility and pelvic inflammatory disease. And thank you for watching.
Hi, so today I'll be talking about the host factors, the environmental factors, and the temporal variation of chlamydia. First, the host factors. Um, Females have a higher rate of chlamydia. There's statistics showing that about 645.5 cases per 100,000 females, mainly because males are less likely to get tested for chlamydia, which increases the chances for females to contract chlamydia because the, the males are unaware that they have this STI. Um, in terms of age, um, 15 to 24-year-olds, which is adolescents and young adults, are the highest um, amongst the age group in America, mainly because of the lack of education that schools provide about STIs, specifically chlamydia, to them. So as they go into college and young adult, they would they wouldn't know how chlamydia is transmitted and um, how how easily it is contracted. Um, and in race, blacks and Native Americans are the top two, um, um, have the top two number of cases amongst each ethnicity, um, mainly because of the lack of education they have about chlamydia and um, and unable to afford healthcare, which is why they most likely will not get tested for chlamydia. Next, environmental factors. Uh, economic factors. Lower income tend to have higher rates of chlamydia. Again, mainly because there's they cannot afford healthcare. Therefore, they are most likely will not um, get tested for chlamydia or seek professional help. Social factors: people who have a higher education have lower rates of chlamydia. It's because they are able to learn more about this STI and compared to people with lower education, which they might not learn um, about STIs and how it's transmitted. Next, temporal variation. Studies have shown that during the fall, the percent of tests came back positive uh, compared to other seasons. I think because, um, the studies have shown that this is because college students, college freshmen, are going to the first year in college that year or that season around that time, um, and with their lack of education about the chlamydia, they're most likely to spread. And ever since 2016, chlamydia cases have increased, and right now it's the highest it's ever been. And mainly because um, high schools and colleges are still not educating the adolescents and adults um, about chlamydia. Um, so that's why that's why adolescents and adults contribute the most to chlamydia.
Hello, my name is Giselle David, and I am part of Group 6. We are covering prevalence of chlamydia among college students in the United States in the years 2010 to 2018. I will be presenting gaps in knowledge, further epidemiological research, and the conclusion. Gaps in knowledge. There are gaps in chlamydia reports involving race and ethnicity. In the year 2011, 26% of chlamydia reports did not include race or ethnicity data. This data is important, and it is important it be taken accurately so that those in public health know which populations require the most resources regarding this issue. In terms of knowledge, college students have a gap in knowledge of sexual health. According to Moore and Smith in a 2012 study, college students are not familiar on transmission, diagnosis, treatment, or prevention of STDs. This information can be related as to why college students are a part of the population with the highest chlamydia rates. Further epidemiological research. In terms of prevention, the creation of a chlamydia vaccine should be further studied so that way individuals are protected against it. In terms of diagnosis, a nucleic acid amplification test is available and it is reliable, but it requires some time to receive results, which can delay treatment. There is also a rapid diagnostic testing, which is fast but is not as reliable. Therefore, more research should be done in finding a diagnostic method that is both fast and reliable so treatment can be implemented right away. Continuing with diagnosis, the study of genetic variation should be further researched so that way the most damaging strain of chlamydia can be found. And in terms of treatment, chlamydia can be cured through antibiotics, although it takes about a week. And permanent damage, if any, cannot be reversed. Researchers should look into creating a treatment that requires a shorter time frame, and also treatment should be done for cases that are quote-unquote permanent damage, so that way they can no longer be considered permanent. Conclusion. Chlamydia has the highest number of STD cases reported at 1.5 million. In the bottom right-hand corner, there is an image comparing the number of cases reported between chlamydia, gonorrhea, and syphilis within the United States. In 2016, the United States spent $16 billion on STD cases alone. And if left untreated, chlamydia can lead to serious health issues, such as pelvic inflammatory disease and increased risk of HIV. College students are amongst the population with highest rates. So with this information, why our group deserves the money is because the money would be invested in education on chlamydia, accelerated diagnostic methods, emphasis on genetic variation, and also accelerated treatment. Overall, investing in preventing, diagnosing, and treating chlamydia will in the future help reduce STD rates, and it will help in reducing the amount of money the United States spends on STD-related cases and resources.